On this month's edition of Connect New York, we're diagnosing New York's public health as we check in with the State Health Commissioner as well as municipal officials on the front lines in the Empire State. All that and much more coming up next.
This program is brought to you by the members of WCNY. Thank you.
Connect New York is sponsored by James Jordan Associates Architects, providing professional architectural services to educational, commercial, and institutional clients throughout New York State. James Jordan Associates Architects, with offices in Richfield Springs, New York.
Geddes Federal Savings and Loan offers home loans, IRAs, money market, checking, and savings accounts.
Geddes Federal, how can I help you this morning?
Personal service. Get it at Geddes. Offices in Westvale Plaza and in Manlius.
Welcome to Connect New York. I'm David Lombardo, host of WCNY's The Capitol Press Room, a daily public radio show broadcasting from the state capitol. On today's show, we're diving into the topic of public health from the state perspective to the county health officials responsible for a host of programs. Later in the show, we'll hear from our panel of county health leaders and highlight a major public health concern in upstate cities, like right here in Syracuse. But first, we're going to play an excerpt of our recent conversation with Dr. Jim McDonald, the State Health Commissioner, who sat down with us at our sister station in the Capital Region. Well, thank you so much for making the time, Commissioner. I really appreciate it.
I'm glad to be here. Thanks for inviting me.
So, for starters, when it comes to public health, what is the state's responsibility to promote and, safeguard the public health?
Yeah, well, public health is a public function. Let's start there, right? And if the state isn't going to do it, and lead the effort, I'm just not sure who else would, right? We really need county health departments for that, but it really is a state function, public health. And one of the things I'll just make sure it's really clear is the New York State Department of Health is different than other health departments. We're actually probably one of the largest health departments in the country because we are one of the very few health departments that has Medicaid as part of its health department, plus the New York City of Health with the Essential Plan. So we're a large payer of health care. We supply a lot of, but we do all the public health too for the state with the county health departments as well. So we're much larger than other health departments because the New York State Department of Health, we're not just the New York State Department of Public Health or New York State Department of Healthcare. We're the New York State Department of Health. We do it all. So we're pretty big in that regard.
And what does it mean, though, to promote public health or safeguard the public health? Is it about alerting people to when there's a disease that's spreading in a community? Is it about ensuring that there's the right amount of healthcare professionals around? What constitutes public health?
Yeah, so it's all of that plus more. And let me just give you our mission first. Because if I give you our mission, you can get a sort of perspective about how I look at the Department of Health. So our mission is to protect and promote the health and well-being for all, built on a foundation of health equity. So yes, it involves a lot of things. And I want to give you the example of Humpty Dumpty, which is probably not what you expected today. But we're pretty good at funding all the king's horses and all the king's men to put Humpty Dumpty back together again. And I think one of the challenges in the United States in public health is making sure we have enough funding for the people who tell Humpty Dumpty, you're an egg, you have no business sitting on a wall in the first place. That's our prevention work. One of the other things we do in public health is we do that work where we tell Humpty Dumpty, if you have to sit on a wall for whatever reason, we're going to build you a harness. We're going to make sure you have matting so we protect you. That's another example of how public health works, where we have to help you customize your prevention a little bit. So that's a little bit of a vignette of the New York State Department of Health with Humpty Dumpty at the center of that.
Well, let's stick with that idea then, because the vast majority of the state's healthcare spending goes towards insurance programs like Medicaid or that downstream cost to, like you said, put Humpty Dumpty back together again. So does the ratio need to be shifted towards more of the preventative stuff, or do we need to think about it in terms of expanding the pie?
So I think about it this way. The vast majority of the money for the Department of Health goes into what I call direct patient care. In other words, we're paying for something that occurs in a room, exam room, operating room, delivery room, emergency room. That's an example of direct patient care. But even a lot of our Medicaid funding, our New York State of Health funding, is moving towards things that actually happen outside rooms. We talk about the 1115 waiver that we just got this year from the Center for Medicaid and Medicare Services. Over half that money is actually going to things to improve everyone's social determinants of health, optimizing people's advantages so they're not getting care inside of just rooms. You asked, should we have more money towards prevention? The answer is always yes. But in the illustration I bring you from the 1115 waiver, though we got $7.5 billion from the federal government, $6 billion from the feds, $1.5 billion from the state, you do see over half that money is really geared towards things that occur outside of direct patient care. There's just examples of where I think the future of medicine is going. Because I think we're learning from what other countries are doing is if you don't improve people's social determinants of health, you really don't lengthen the quality of their life. And when I talk about social determinants of health, because that's a term of art, it's things like safe neighborhoods, safe housing. Governors made a big priority about safe housing. Making sure people have good education, another priority of the governors. And it really these are things that are really important. Like, what are the things that make us live longer? Transportation. These are social determinants of health. These are examples of an economic, opportunity. These are things that really matter to people that occur outside of the traditional healthcare model.
Well, sticking with the federal Medicaid waiver that you mentioned, when it comes to the flexibility to spend some of that money moving forward, what are your expectations? Is this something that's going to radically alter the public health landscape, or do you think this is something that's more around the margins and hopefully we can build on any successes we see?
Well, let's just take an example of the investment we have in workforce. Okay. Because we have an almost $700 million investment in workforce. Now, although $48 million is going towards loan repayment, and loan repayment is a worthy thing to invest in, you don't want all your money in loan repayment. Because what you really want to do is spend most of the money in what are called career pathways training. And part of what I'm getting at there is I want to encourage people in high school to look at healthcare as a profession, people in college to look at healthcare as a profession, and people in graduate school, how to get through. But it really gets about how do we mentor people? How do we encourage people to get into a job in healthcare, which, by the way, healthcare jobs are not just financially rewarding, they actually nurture your soul as well, because when you're helping people, you sleep well at night. Nice thing about healthcare jobs, too, is they're generally full-time, and they come with health insurance, which is really another critical social determinant of health. So that's an example of how we use the 1115 waiver to kind of set us up for a future of success where we are helping the healthcare workforce. Another example in the 1115 waiver, though, is our social care networks. This is $3.4 billion that we have invested in this. And the social care networks are purposely being built in a way to actually improve people's individual social determinants of health. Do you need help with, if you're a Medicaid recipient, do you need help with housing? Do you need help with transportation? Do you need help with your chronic disease management? In other words, how do we customize the help you need? Recognizing, by the way, that New York is a big, big state. The needs of someone in the North Country might be different than someone in the city. And so the social care networks have the ability to customize what they're doing to optimize everyone's social determinants of health.
Well, you mentioned workforce, and when you and I spoke last year for the Capitol Press Room, shortly after your confirmation, you shared a goal you had of getting the State Department of Health back to quote-unquote full strength when it came to personnel by the end of 2023. Were you able to realize that goal? And if not, where in the personnel picture could there be improvements?
Yeah, so the Department of Health is growing. I think it's no secret that during the pandemic, a lot of people left public health.
And even in the wake of the pandemic, though, you talked about 2022, you gained 800 people, but you also lost 800 people.
That's right. In 23, we were plus 300. So far, in aggregate now, we're plus another couple hundred. So we're above pre-pandemic staffing. So we're heading in the right direction. I still have vacancies, but not massive amounts of vacancies. An example is, I'll tell you this story. When I came to interview the job at the New York State Department of Health, I met with Dr. Bassett. Keep in mind, I moved back home for family. I didn't move back for anything more than just being near my family. And Dr. Bassett was like, where do you want a job here? We got openings everywhere. Because for a public health physician, it's like, where do you want to work? We got, very diverse resume. You've done everything. You can have any job you want here because there was all these openings. I don't have any openings for physicians right now at the New York State Department of Health. So that's an example of where we've actually recruited all the physicians we need right now. So that's an example of how we've made tangible progress. And, culture matters, by the way. No matter what organization you're running, you've got to build a positive culture. And I'm very purposely trying to make sure we build at the New York State Department of Health a very positive culture. Because you spend the best hours of your day at work. I like people to be happy at work. That's really important to me.
Are there certain areas where you're looking to fill that have potential vacancies that are a real problem, or because of the dearth of bodies?
So where I see us expanding in the future is, the state's made a commitment to emergency medical services for the state, and that's something that over the next year we're going to hire 150 people in that area. It's not that I have a shortage, it's just a new area, a new service line we're going to be doing, more supplemental emergency medical response to the existing emergency medical services system. So we're hiring 150 people in emergency medical services over the coming years. So I'm excited about that. Of course, we're always hiring in Medicaid to help people determine eligibility. But I have openings in public health, but probably about 50 to 100, not as many as I used to. It's not like there's these wide areas of vacancies right now.
Well, I want to turn to the counties, which is where the rubber meets the road, so to speak, because they're the ones with a lot of mandated responsibilities when it comes to public health. But they argue that they are stretched very thin. And I'm curious what you see as the capacity of local health departments.
Yeah, so county health departments are critical. When I think about, there's Hamilton County Department of Health, which is the smallest county east of the Mississippi. Then we have the New York City Department of Health and Mental Hygiene, which quite frankly is bigger than the state health department when you look at its number of employees. So there's a wide variety there. But county health departments are limited by county budgets. We help where we can. Like where I have district offices in the state or in the rural areas. Part of why I have district offices is we provide that environmental health function for local health departments, inspecting restaurants, camps, making sure water is safe. We do some of that. We do as much investment in county health departments as we can. One of the things that's been really important to me since I've been commissioner is we're building the partnership with local health departments. That wasn't, as strong during the pandemic as it should have been. But it's really important to me that we build up the relationship with local health departments because their needs vary throughout the state. A county like Erie County that's got a lot of resources isn't going to have the same issues as other rural counties in the state. So it's important to be available. I try to be available and accessible to all the county health departments, and our team does as well to try to supplement what they need.
Are you concerned, though, about some of these counties having to triage the services that they provide, having to let certain things fall by the wayside because they don't have the capacity to check up on rabies bites or do some sort of inspections of cigarette sales or whatever it is?
Well, I think those are examples of where county executives need to make difficult decisions. With county executives being limited in how much they can tax, there's only so far they can go. So I am concerned about county health departments. Enforcement of things like vaping and tobacco is a good example. I'm not convinced that public health professionals are the right people to make that enforcement. I think it's something we need to be thinking about because more and more enforcement looks more and more like a law enforcement type thing. But I think we need to create a space for what that enforcement looks like so it's done sensibly. But to your point, too, about restaurant inspections, we supplement the rural areas of the state with our district offices. But part of why people feel comfortable going to a restaurant is they know a health department has vetted it and said that restaurant's serving safe food. This is an example of how important it is for public health to be well funded, so we're not wondering about our restaurants.
And now we're checking in with our panel of county health officials, and we're joined in the studio by Dr. Catherine Anderson, Health Commissioner for Onondaga County, and Diane Devlin, Director of Public Health for Wayne County. And piping in remotely is Dr. Gail Burstein, Health Commissioner for Erie County. So Dr. Anderson, we just heard the statewide perspective on public health. As a county health official, how do you begin to think about public health, especially as it pertains to what you're mandated to do from the state and what you might want to try to prioritize because of the maybe unique circumstances in central New York?
I'm just rounding the bend on 2 years in my position, so I'm coming in with a somewhat new, like a fresh perspective on this. And I'll say one thing that really astounded me in stepping into this role was the vast array of activities that we do and that people have no idea about. So from the moment you wake up in the morning and you drink a glass of water that is safe because our team was involved in inspecting it, to eating at a restaurant that you know is safe, your child is around other vaccinated children and not at risk of severe infections because everyone's immunized. The list goes on and on and on. The thing that remains a necessary tension is balancing that long list of things that we must do as practitioners of public health, these various mandates that are critically important, but then being responsive to the needs of our community and reflecting on what the state commissioner had said, really getting into the social determinants of health. So we have programs, a lot of us have very similar programs from county to county, but what our community needs from us is different and rooted in history and needs to be adaptive. So to me, that's been one of the central struggles, is how do we work with what we have, how do we work with what we must do, and how do we be responsive to the community with all that in mind?
Well, what does that tension look like for you, Diane, in Wayne County, which is a very sparsely populated county, which probably presents some challenges, as well as just a rural community as well?
Right. It's a medium-sized county, so we...
Didn't mean to put you on the defensive
No,
there.
none of this, in the land of public health, we're considered a medium-sized county. But in regards to how that looks in my county, it's much different when you have a rural county. I have 25 employees, and I was very fortunate throughout the pandemic to not lose any employees. So I was very, unlike other health departments that throughout the state did. But our programs that we provide are mostly the mandated programs because of the lack of funding and also the lack of employees. I don't have a big budget to hire a whole bunch of new employees in order to provide needed services in the county that could be address the social determinants of health. We don't have transportation like you do in the urban counties, where you could get on a bus and go downtown and then get back home. We don't have adequate housing, which is across the state. I believe most of the counties are experiencing that. But the resources, we lack resources in regards to what you could find in the urban areas, and we have to travel because we don't have access to care for specialty medical services. So it's a lot different in the rural counties in that aspect, where we lack resources, we lack the funding, we lack the staff in order to provide more innovative programming other than what we're mandated to do, and about a third of my budget is funded by the county. So.
Well, I want to follow up on something you mentioned there, which is the fact that your 25 employees, you're able to hang on to all of them during the pandemic. What was that a product of? What was your secret sauce? Did you just threaten everybody from leaving?
Oh, no, we worked very much as a team, and I was right there with my staff from first one in the morning, the last one out at night. So I was doing case investigations, I was doing contact tracing right along with them after I got done doing my normal work during the day. So and staff was just very well, willing to do what needed to be done, and they were there at the table. So I had early intervention service coordinators doing case investigations after they got done doing their normal work duties.
And we're going to talk more about COVID-19 and the lingering challenges that presents, but Gail, I'm curious, as someone who represents a large county, how do you differentiate between the time you spend on your mandated responsibilities and the unique issues to Erie County that you might want to try to prioritize?
Right. Well, again, we have a vast array of mandated services that Erie County offers, and many of them, people are unaware of. Many of them are frontline, like lead, tobacco, early intervention. And fortunately, we in Erie County, we have a robust, very smart, efficient staff, and the mandated services, and we have a system in place, and they're ongoing. And then usually I don't have to micromanage anything there, but unfortunately, public health crises arise, and so I really have to put an eye on that. I mean, right now, Erie County, just like many counties across the state, are struggling with our drug overdose epidemic. So we're putting a lot of resources into that, and I'm really working hard with our Office of Harm Reduction staff to really try to make a dent in these number of overdoses and save lives and prevent deaths. We also are really struggling with social determinants of health. There's a lot of poverty in our community, and so we have an Office of Health Equity in Erie County, and we've been working with them to try to address the social determinants of health, to raise the health of the entire county. So that's something that we're really working on. So again, we're working on the mandated systems, and again, they're routine. We have systems in place to handle that, and then we're really trying to address some emerging problems that are really novel, and we have to create novel systems to address them.
Well, Gail, you brought up the ongoing overdose epidemic, and I'm curious, as a county health leader, what are some of the programs that you're trying to implement, and how has your capacity changed, if at all, with the distribution of money from the Opioid Settlement Fund Advisory Board, which is going to be steering potentially a few $1 billion around the state?
Yeah, well, we're trying to follow evidence-based guidelines, and so we have an entire office of harm reduction. So we're really trying to focus on harm reduction, to prevent deaths and save lives, and and help people on the get onto the spectrum where eventually they would want to get into treatment, and also looking at the changes that we've seen in our overdose epidemic. Initially when we first started looking at this in 2015-16, it was primarily due to opioids. First heroin, then it transitioned to fentanyl, which is very, very deadly. However, now we're seeing a lot of cocaine, and with or without fentanyl, that is unfortunately causing deaths among our individuals in our community. Also, we're seeing a changing of demographics. We're seeing at the beginning of our opioid epidemic, we saw many of our overdoses, a disproportionate number among young people in their late teens, 20s, 30s. Now unfortunately many of our victims are my age and or older, people in their 50s, 60s, 70s. We're also seeing a more diverse population. We're beginning in 2015-16, our victims were primarily white males. Now we're seeing more diverse population, more people of color, and actually a disproportionately high number of people of color. So again, we've had to refocus and retool and really looking at targeting a different population and putting more emphasis on harm reduction, but still looking at treatment, because the ultimate goal is getting people into treatment so they can get into recovery and feel healthy again and rejoin the community and their families and save lives. So we're doing a lot with outreach. We're doing a lot with Narcan, getting a lot of messaging, never use alone. Even if you think that you're using cocaine, a lot of these drugs are tainted with fentanyl, and so always have Narcan with you. Always have somebody there that can rescue you if you're just alone. Call a service like Text for Narcan or Never Use Alone, which is actually a service that you can go online and get somebody to call you and be there on the phone with you. And if you don't respond, they'll call 911. We have a service, Text for Narcan, where you can actually, all we need to know from the text is where you need us to send the Narcan. We have peer supports that we deploy for people. We have fentanyl test strips. We're mapping out where our fatal and non-fatal overdoses occur and deploying our peer navigators out to those areas to really, talk to people and provide harm reduction. So we've really changed what we've been doing.
We heard about some of the harm reduction tools that they're using in Erie County, whether it's Narcan, the Never Use Alone policy, distribution of test strips. How does that compare to what you're trying to do in Onondaga County?
Very similar activities and very aggressively advancing our harm reduction. And I would say, you'd asked about the impact that the settlement funds has had, and that's been huge. If we think about the ability to receive resources locally and build something out that's responsive and locally tailored, that's been really, really valuable. So we, for the first time in the last 2 years, have seen what had been an exponential rise in opioid-related deaths start to decrease and level off. It's not zero, and we want it to get to zero, but we are optimistic that the harm reductions efforts, the Narcan, the fentanyl test strips, the xylazine test strips, peer supports from the county, as well as others in Onondaga County, are starting to make a difference, and we're going to keep pushing aggressively in this space.
In Wayne County, do you run into challenges like probably on other issues about actually reaching people, whether it is distribution of Narcan or getting people to treatment because of the rural nature and transportation challenges?
Yes. So I was very interested in hearing what Gail has stated, all the different services that she's able to provide. But my harm reduction team is one public health educator who is funded with the tobacco settlement money. So we only received a small amount of the opiate funding from our county, so I'm not able to establish a whole department or anything like that, but we pick away at it. We do have the educator and other staff trained on how to do, teach Narcan to individuals who are interested. We release all that out into health fairs, and we do red boxes that we, put up in the community, and we're in the process of doing that. We still have more to do on that, but our efforts are small. We work very well with our local behavioral health department, which is located basically in the same building as us downstairs, who has the open access center for drug treatment, and for individuals with mental health issues could walk in at any time to receive services if they're in crisis. So there's also a opioid task force that we have formed, and so that's where police, law enforcement comes together, emergency medical services, the hospital comes to the table, the health department, the behavioral health services. So we all look at how can we get the data, how can we get the message out, how can we, reduce bias if you are using.
Well, I want to pivot to another issue, and that's the concern of lead, which is a major problem for upstate communities with aging infrastructure, which really covers a lot of municipalities in New York and across the country. But before we talk about the health risk of lead amongst ourselves, we're going to get an update on the Syracuse community's ongoing effort to address this problem, and Connect New York producer Alec Ambruso has that story.
Lead poisoning in Syracuse in particular has been a real problem for a long time, but a lot of these upstate cities that were industrial cities have lead paint in the houses, lead dust in the soils, and it's a very severe problem for especially our children.
So for my family, lead poisoning is now generational. My experience with lead poisoning started 4 decades ago when my brother was lead poisoned, literally just a few blocks from where we're standing now. He was 2 years old at the time. We knew a lot less about lead than we do now. So his lead levels got pretty high. He seized every day of his life from 2 until he was 13. Now at 44, he has outlived both of my parents. And so myself and my other siblings are responsible for his care now. Essentially, we have an 8-year-old and a 44-year-old body. You fast forward 4 decades later, when we thought lead was essentially solved, and one of my grandchildren became poisoned in this home, which we were the renters of at the time. We are now the owners. And this brought up those feelings all over again. What would her future be? What would happen? How do we solve this problem? And we thought we were the 1 in a million, and we weren't.
Unfortunately, early in life especially, lead can deposit in the brain. And once lead gets across the blood-brain barrier and deposits there, it's very difficult to get it out. Our systems don't do a good job of clearing lead, whether it's out of our bones, where it tends to deposit, or out of our brains. And in adults, much less percentage can cross the blood-brain barrier, but in children, it's much more permeable. And so that's the concern, is that it affects learning. And so it's a relative scale. If one child has a blood lead level that's at 1.0 micrograms per deciliter, and another has a level of 5 micrograms per deciliter, that child that's at 5 is going to be learning impaired. Slower learning, less likelihood to graduate high school, and there's actually statistics on higher crime rates.
We can trace the association, not the causality, because that's still something we're working out, but we can show the overlapping of areas of lead poisoning with poor educational performance, with, teen pregnancy, with entry into the criminal justice system, and so on. So there's a whole set of ramifications. In Onondaga County as a whole, we had 25.3 children per 1,000 with lead levels greater than 5 milligrams per deciliter. That compares to 12.1 for the state. For children with lead levels of greater than 10 micrograms per deciliter, in Onondaga County, we had 8.8 children per 1,000, compared to the state of 3.8. Now, within Onondaga County, lead poisoning is greater in the city than it is in the outside of the city.
So there's no need for a child to ever suffer from childhood lead poisoning. You prevent it by simply removing the source of the lead, whether that is lead paint, whether that is lead pipes, whether that is lead found in the child's environment. Syracuse has a large population of homes built pre-1978, and that was the year that lead paint was banned in the U.S. And because there has been a lack of good enforcement for landlords to upkeep those properties, we expose hundreds of children every year to lead. The zip code that you're standing in right now, 13205, if you are a young black male child, you have a 1 in 4 chance of being poisoned in your home.
We passed my bill called the Tenant Dignity and Safe Housing Act that allows people to essentially sue their landlord over unsafe living conditions and either withhold their rent or get a judgment to allow them to fix the problem. So really trying to make sure that we're putting tools in the hands of people who are trying to protect their children. So there's federal money to try to get lead pipes out of houses so that, or the lead service pipes, replace those so we're not getting lead in drinking water. There is funding at all levels for lead paint removal. I'm working very hard on just trying to build a lot of new housing because new housing isn't going to have lead paint in it at all.
The city's efforts are primarily in making sure that there's oversight when we come in contact with the housing inventory of the city. That is either through complaint inspection, that's going to be through periodic inspections, which is certificate of use, certificate of adequacy, and of course our rental registry program. When inspectors go in, we're going to be looking to make sure that there's no deterioration or chipping hazards. And if the home is built pre-1978, we're making sure that it passes a visual inspection. And the final piece of that is in order to pass those inspections, we're requiring what's known as clearance. So we're going to engage you to get lead dust wipe testing to make sure that there is no presence of hazards. I think a little over 700 properties total have come back where there was visually, something to grab onto. Since January, about half of those properties have had their lead violations seen to and closed out. So we are looking at a pretty decent volume. I mean, like if you are driving through the city, you'll see a few.
Central New York, Onondaga County, they have a particularly great relationship with the city of Syracuse, working on the lead problems that they encountered there. And they work closely with code officials as well as they have coalitions of community members all working on housing issues, children's health issues. The Lead Safe Central New York Coalition is very active, and Onondaga County has been great in helping to set that up. So that works at the community education level, but also on things like setting up a mobile van, a testing van. Now, one of the challenges is getting all those children at ages 1 and 2 tested to make testing more accessible in the community so that parents don't necessarily have to bring their children to a pediatrician well baby visit if they can't get out to the doctor or if that doctor's office doesn't have testing right in the office. This mobile van showing up at community events is another great access point to get your children tested.
There is no price we can put on a child's brain. Imagine having your little baby and at the age of 2, microscopic dust that you didn't even know was in your home robs your child of their entire future. I watched my parents live through that, and now I take care of my brother every day. I think our future on lead poisoning can be positive. We have families' voices at the table now. There's other organizations like ours around the state who are bringing these voices to the table. But it's important that policymakers listen to us, as directly affected.
Well, what's your capacity as a county to respond to this problem, and how reliant are you on state and federal dollars?
So I like that question because it's an area where, again, we've been very able to benefit from an influx of resources. In the opioid case, that was opioid settlement dollars. In the case of lead, we have an investment from our local county in terms of giving us relatively flexible funds to address the lead crisis in our area. And so that's being used for a variety of reasons. We're increasing our approaches to testing using a mobile van and getting out into the communities and allowing us to set up satellite testing areas. We're increasing, or I should say the Department of Community Development is increasing training of contractors who are certified to do lead removal, which is really getting to the source of the problem. And then really just trying to move the needle on making sure that everyone is living in safe homes, particularly rental homes. And so we have a balance of state funding as well as federal funding, and this local funding that really allows us to be nimble and flexible and build out things that are locally responsive.
Gail, in Erie County, do you feel like you are a single actor trying to take on this challenge, or do you feel like you're part of a larger tapestry addressing the problem, especially in communities like Buffalo?
Yeah, well, unfortunately, the city of Buffalo is a very poor city, and it has among one of the oldest housing stocks in the country. So there are many homes in in disrepair that have lead-based paint and exposing young children in their homes. So we're working hard, sometimes with community partners and to really identify those homes, those children that are at risk, and provide them with the services to help them remediate. Our pediatric partners are great with testing and identifying young children who have elevated blood lead levels. We've also this year started some novel programs to really try to address the lead. First of all, we have a specific a lead court, so a housing court just completely 100% dedicated to lead issues, to try to get landlords to do the right thing and the repairs in the home for lead abatement and to make the homes safer for families. We also have a lead safe tool borrowing program. So it's really a tool library program where it's people can go to this facility called the Tool Library and rent out tools for a very, very low cost to make those expensive home repairs. Otherwise, some of these equipment can cost thousands of dollars that people can't afford to buy, so they can borrow them like a book library. They can borrow these tools from our tool library so that they'll be able to do the repairs that they need to make their home safer. We also have a program called Let It Go, and it's a program to work with families to help children who are exposed to lead become school ready and help them despite the potential developmental threats that lead exposes. We're helping them get some early intervention in their home to help the children be school ready. So I think it's this is a big problem in our not only the city of Buffalo but some of our first ring suburbs that we're really trying to focus on keeping families safe and young children safe.
Well, Diane, there's this narrative about lead being an issue that is primarily for the industrialized core, for those aging urban communities. Is this something that you have to deal with in Wayne County?
Yes, our eastern half of our county definitely has some housing stock that is built before 1978. Our way of dealing with lead, however, is much different than the larger counties that have that are full service, because they have an environmental department. They can do a lot of the lead testing. They can do in the homes and identify where the lead is. I don't have an environmental health department. I'm a partial service county health department. So therefore, we use the New York State Department of Health's Geneva District Office, and they go out and do that along with our lead coordinator when we identify a child with an elevated blood lead level. But part of the problem in our, we see a lot is that to abate lead from a home usually is not getting done. So we have to do a lot of education. Mostly why it's not getting done is because the landlord may not be able to afford it, or doesn't want to do it, or or the family, if they own the home, they may not be able to afford to do the abatement. So we don't have, I'd love to have a machine, tools based where we could loan out to community members, but what we do is a lot of lead education. Our lead program coordinator, which is a registered nurse, goes into the home, and we will provide them with cleaning products like a broom and, not a broom, excuse me, a mop and a pail and sponges, and teach them how to clean up the lead dust. And therefore, it's a much smaller way of dealing with it, unfortunately.
Well, you mentioned this Geneva location for the State Department of Health, which reminds me of something that we saw Commissioner McDonald mention, which is this idea that in smaller communities, the State Department of Health plays a larger role. And I'm curious, what is that relationship like for you with the State Department of Health? How do you rely on them? Is it a two-way street where you're sending in requests and they're saying, here's what we've got? Is it the case where they're just like, here's what you can have, go forth and conquer? What's that relationship like?
So because they do our environmental services, they do all the restaurant inspections, they do public water systems, inspecting them, they inspect the public school pools if they have them. They will do the lead abatement testing not abatement, but the lead testing for us in the homes if we identify a child with an elevated blood lead level. So we work very closely with them. If I get communication that, say, a trailer park's water is going to be shut off, I call them to let them know, because that's going to affect their public water system if the water gets shut off or if their electricity turns off. So we are constant communication as needed, and if I can pick the phone up at any time and say I have this concern, or they can do the same thing, and we'll pull our bootstraps up and get to work on the situation.
Well, what's the Onondaga County experience like? Because I have to imagine that they expect you to take on more given the size of your county.
We do have an environmental health division, and we're a full-service county. We do have a regional office. We all have a regional office that we work with, and they're very supportive in terms of being a liaison, advocate, a support in terms of navigating, working with the New York State Department of Health, which is a big organization, as you heard the commissioner describe. But by and large, we are more independent in terms of what we do. At the same time, a lot of what we do does end up being funded by New York State grants or other funding sources, because they're the coordinating body for a lot of our activities.
And what's the ratio of funding for your activities compared to state and federal dollars versus what you need to go begging the county legislature and the county executive for?
Well, most of our funding comes from a variety of distinct programmatic sources, so could be state, could be federal. I think that's the majority. And there is a tension there, right? So the counties are, if we go after requesting county funding, that's taxpayer dollars, for which there are a lot of other demands, a lot of reasonable accountability in terms of how and why these are being used, other things that are needed in the city of Syracuse. So for that reason, we, and I don't think we're alone in that, try to seek most of our funding from external sources where we can.
Well, Gail, this spring we heard from the Nassau County Health Commissioner about her concerns with the state budget proposed by the governor, and she made the argument that there had been a series of state budgets that were basically jeopardizing the capacity of county health departments. And I'm curious what the experience is like for Erie County and how far you have to stretch your state dollars.
Well, we use every single state dollar that we're able to obtain. However, it's not always enough. For example, through our county executive leadership, we were able to fund our lead program to actually expand it and provide services to children with a lower elevated blood lead level compared to what the state funds, so we could able to reach more children at risk. We're always struggling with reimbursement issues with early intervention. And so, that's really frustrating. As a pediatrician, I know that's a very needed experience. However, the state's resources have, not just money-wise, but also technical assistance has been really helpful to move our agenda forward. And our regional office, our Western Region office, has been a great resource and has really partnered with us to help us address, some initiatives that were very complicated, such as the Buffalo Water Authority, eliminating fluoride from their water, and helping us to to work with the Buffalo Water Authority to get that back on track. And so we're hoping this summer we'll be able to see fluoride again in for water for Buffalo residents. So it's it's really a combination. We can always use more. We're seeing more TB in our community. The TB budget has been flatlined for years, and so we've had to put more local resources into that. So it's always push and shove, and where we can get resources.
Well, next, I want to hear how, if at all, you're still responding to COVID-19. But first, we're going to get the state perspective on this issue with a final excerpt of our conversation from this summer with New York's Health Commissioner, Dr. Jim McDonald. In terms of public health threats, can you put into context the danger of COVID-19 at this point?
Well, COVID-19 is now like a regular viral infection, I think akin to influenza. It's hard to predict where it's going to go, but I think we're starting to see where it might set into a seasonal pattern here. But I think what I would think about perspective is we're still seeing more COVID cases than we are flu cases. So it's the prevalence, the number of cases that we still notice. Even though we see decreases, you don't see influenza in New York generally during the summer, right, but we still see COVID. So that's where it's a little bit different. As we build immunity, as we see uptake of vaccine, we should see less people ending up in hospitals, which is what we're seeing. I think the real trick is, are we going to get enough people to take up the vaccine? Because when you look at vaccine uptake last year, it was not robust at all, and it wasn't for want of trying. But I think this is an example of where, unlike anything else I've ever seen in public health, this particular disease got so politicized. People form deeply held beliefs. And one of the things I think it's really important for the public is always be open to new information, always be asking questions. But your doctor isn't confused about whether or not you need the COVID vaccine. I would ask them. And as I get ready for the fall, as we think about where we're going, it's the 65 and older crowd I worry about for a COVID vaccine.
So turning to Onondaga County, I'm curious what, if any, pandemic-era programs or regulations or rules you still have in place, or has this whole problem converted to, as the health commissioner described, more of a flu-like annual concern that you have to address?
Just about all of our COVID-related regulations that came from the state or the federal authorities, as well as the funding, are now ending, either earlier this year or this summer. That said, COVID is still with us. We don't talk about it as much as I think we still should. And I agree with where the commissioner was going in terms of it's similar to influenza, but different in the sense that more people are still dying of COVID. COVID is still here in the summertime. It's not clearly seasonal yet. So it's still here. And most disturbingly, the people who could most stand to benefit from the tools that could keep them alive, being vaccines or Paxlovid, are not getting them at the frequency they should. So it's still here, it's still a cause for concern, although we do have some protection from the levels of immunity that we're not seeing these surges like we did with Omicron. But it's still an unmet need and a concern in our community.
Well, how do you ensure people get vaccinated for not just COVID-19, but all the other range of preventative immunizations that we have out there? And what sort of responsibility does a county health official have when it comes to those issues?
That's one of our mandated activities, to ensure that our constituents have access to the vaccines that they need. With respect to COVID, as mentioned, it's been highly politicized, unfortunately, which means that avoidable deaths and hospitalizations are happening as people choose not to get vaccinated. But I think what we can do as a local health department, and what we're trying to do, is just lower the barriers to everyone else who may be interested in receiving the vaccines, to provide education, to be very vocal about the value of vaccines, and then to make it easier for people to get them.
Gail, in Erie County, when it comes to vaccination uptake, what sort of challenges are you facing? And with the school year right around the corner, what are you bracing for with those immunization requirements?
Well, just in terms of COVID, as my smart colleagues have mentioned, that the COVID vaccine has become so politicized, and so people are basing their behaviors on beliefs that are not necessarily based on facts. So that's very frustrating because they're a very vulnerable population. Our older adults, people with other chronic health conditions that should be immunized and protect themselves, as well as for influenza and for our friends 70 and up, RSV, may choose to forego any or all of those vaccines and potentially, suffer some serious consequences such as hospitalization and even ultimately death. And just in terms of vaccines in general, so everybody listening out there, if you have school-age children, make sure that they're up to date and get them their vaccines that they're missing this summer before school starts. New York State has some pretty solid rules around required immunizations for school entry. So only medical exemptions are allowed right now, just to make sure that they're to prevent any outbreaks of any vulnerable children in school, because there are some children that can't take vaccines for medical reasons. So we're really trying hard, working with the schools, working with the community, messaging, making sure that everybody checks in, making sure their children are up to date with vaccines. We have a small footprint in the Erie County Health Department with an immunization clinic. However, we can't meet the needs of the thousands of Erie County school-age residents for their vaccines. So we're really trying to message to get families to remember to make sure that their kids are up to date with required vaccines before school starts. It'll keep everybody healthier, and it'll make sure that kids are able to learn.
In Wayne County, when it comes to promoting vaccinations, whether it's COVID-19 or things that are unique to school-age requirements, is that another area where you have to partner with the state or other entities, maybe school districts or other stakeholders?
Mm-hmm. We have a very good relationship with all the 11 school districts in our county. So if we need to promote any health education on any terms or any topic, I should say, I can just reach out to them and they will respond and put the message out to their students and families. They also have a really good relationship with our immunization coordinator. I have one. So they'll call whenever they have a child that needs to have vaccinations because they either moved to the area and they didn't have them, or they're children that are just entering the school age and the families weren't able to get their vaccines. So as a local health department, we are the provider of last resort. We will provide vaccines, whether it's public vaccines, the Vaccines for Children, which is free to anyone who qualifies for that. And then we also have private stock, so we do invest in that for children who do have insurance that can come to our clinics. And during the summer, we will hold extra school-age clinics at our health department because you get an influx of students at the last minute that need to get their vaccinations. But we do mostly promote these children to go to their primary care physician, right, so that they could be seen for any other issues if needed, like have a physical. We are going to start trying to get our vaccinations out in the community because we have just recently, back in February, obtained a mobile health vehicle. So we're hoping to be able to go out in the community and set up at school districts, set up in the community for anybody, adults or children who might need to have vaccines, that can come to the mobile health vehicle and receive their vaccine of choice. So.
Is that challenging to set up a mobile capacity like that, whether it is for distribution of vaccines or any other sort of treatment that you're hoping to try to meet people where they are?
Yeah, I think it would be challenging just getting the word out and getting the population understanding that we have this service. So it's going to probably have some bumps in the road, for us in the beginning. But if we're going to be setting up at a school district, we'll definitely work with the school district to get the message out to their families, and we'll work with the town halls and stuff to get the information out to the community residents. So if they need a vaccination but can't get to the local health department or to their primary care physician because of transportation issues, then they can come to our mobile vehicle within their community to get that vaccine that they need.
In Onondaga County, are you having to get any influx of immigrants or asylum seekers specifically vaccinated for school, or is that not necessarily been a challenge here in Onondaga County?
So we have a mandate to ensure that any of our constituents, particularly those who are uninsured or underinsured, have access to the vaccines they need, and in particular to remain in school, because that's a very dramatic thing if a child is excluded from school because of their vaccines, which is what's at stake here, as Gail was saying. Specific to new American populations, we're lucky in Onondaga County to have a relatively high rate of resettling refugees in particular relative to our population size. So as an example, there's different classifications of people who are arriving into the United States. To be clear, refugees are individuals who have been living abroad, often in refugee camps, and have undergone this extensive period of vetting before they're accepted to be resettled in our community, including medical exams and things like that. This year, we're receiving more refugees into our county than we ever have in our history before. And that is both positive, because refugees bring so many benefits with them. They transition quickly to independence, they bring economic growth. At the same time, they need support. They need medical support at a time when we know it's hard to find primary cares and for people to get the appointments that they need. So that is one area where we have pivoted as a health department to be responsive to our local community needs. And so as a local initiative, we've established a new refugee health hub that is evaluating each family as they're coming in, often with pretty substantial medical needs that are time sensitive, triaging them, helping ensure that they're linked up with the care they need, and trying to make things go a little bit more smoothly for these newly arrived families. And that will involve as well ensuring that they have the vaccines that they need for school.
Well, unfortunately, that's all the time we have for this conversation. I'm sure we could go on for another hour at least. My thanks to Health Commissioners Catherine Anderson and Gail Burstein, as well as Health Director Diane Devlin. If you'd like to revisit this episode or dig into the Connect New York archives, visit wcny.org/Connect New York. And for more state government coverage, including conversations about the local health director's agenda in Albany, please check out the Capitol Press Room at capitolpressroom.org or wherever you download podcasts. On behalf of the entire team at WCNY, I'm David Lombardo. Thanks for watching.
This program is brought to you by the members of WCNY. Thank you.
Connect New York is sponsored by James Jordan Associates Architects, providing professional architectural services to educational, commercial, and institutional clients throughout New York State. James Jordan Associates Architects, with offices in Richfield Springs, New York.
Geddes Federal Savings and Loan offers home loans, IRAs, money market, checking, and savings accounts.
Geddes Federal, how can I help you this morning?
Personal service. Get it at Geddes. Offices in Westvale Plaza and in Manlius.